Innovation and Quality Improvement Award. Amanda Mallory and Lacey Vaughn, Central Oklahoma.
We had a group of people from all different areas of the agency and from different generations of services that have different views, and brought us all together so we could create this idea of serving people better.
But it was just a component of bringing us together and saying, okay, where are the actual issues? Where do we need to come together? How can we solve this and everybody be satisfied?
We're just lucky that our first guiding team turned out to be really successful.
Raymond Camp, Central Oklahoma.
Since I've been here at Central Oklahoma, there have been several times Ray has come and presented something to me or to a supervisor or to our management team about ways he's seen to improve our processes, how to do the work we do even better and provide services.
My main function here is the CDC uploads, prior authorizations, and all that goes into that. So my unenviable task every morning is to come up and pull up all the errors that happened with the upload, and then I get to send people what they affectionately refer to as hate mail, telling them that they have to fix something. So I just basically came up with some solutions, some additional reports, some additional auditing that I do on my end, which not only saves the clinicians time and effort, but it also ensures that we don't have those things falling through the cracks, and then we're catching them, we're getting the reimbursement dollars that we are entitled to, and things like that.
OFC Competency Evaluation Team.
In late December of 2015, OFC was tasked with a problem that we were having across the state with competency evaluations. Well, we changed the process, and this took working together with all the CMHCs in the state, working with our psychology department, and a lot of work from the administrative offices here at OFC in coordinating the change. And the change basically was we needed the people in the respective communities, the licensed mental health professionals there, to do the competency evaluations. We had to train them how to do those competency evaluations. And then we had to monitor it and make sure that cases didn't fall through the cracks.
Hopefully, as we continue doing more of the trainings and that sort of stuff, keeping up with staff and that sort of thing in all these different agencies allows us to hopefully try to stay on top of getting folks evaluated, getting them services when they need it as soon as possible.
TCBH Building Blocks Program.
What we wanted to do was to impact the greatest number of clients, and we felt like the talents of our clinicians was being underused. So we looked at starting a program that was focused on groups. So Building Blocks is a program where we have groups from morning until night, so the clients have something available to them almost every period of the day.
Consumers are interacting with each other more positively. They're interacting with staff more positively. Our units have become so much more calmer because they have something to occupy their time. They're actually learning things that's going to help them in their daily life when they get out of here. Dealing with your addiction, replacing it with something positive.
Clara Griffin, Children's Recovery Center.
There's always been a problem with having enough time for direct care, like the PCAs and the CRSs having enough time to do their charting. And so the idea was brought up to if we could figure out some way to get them where they could spend more time on the unit and less time documenting and making the documentation more accurate to decrease recoupments.
Our recoupment this year from a fellow state agency was the lowest that it's ever been since I've been at the Children's Recovery Center. So her work is remarkable, and it shows every day, and she's very deserving of the Innovation Award.
I don't know, I just feel like it's something that I was supposed to do.
GMH Thunderbird Employment Partnership.
When Lori came to me with an idea of hiring one of the Thunderbird Clubhouse participants, I happened to need a temporary part-time person up in finance. Well, the goal is for them to come here, learn a job skill, get used to working back with people and with the public, and then after 6 to 9 months, they'll rotate out and hopefully go on to flourish in a full-time job or whatever career they decide to go with.
A lot of these folks have a very difficult time finding employment. In totality, we've had 4 individuals enter the program and 1 succeed. It's just unique and it deserves applaud and an attaboy.